Dr. Jordan stated, my name is Tracy Norman, and I am the program manager of the Addiction Treatment in the Black Community Project. You all will learn more about this project and community-based treatment options in today's session. So before I begin and introduce everyone who's on the agenda today, I just want to inform you all that this session is being recorded. It is our hope that we will be able to disseminate this recording to others and bring awareness to this topic and our work within the Jordan Wellness Collective. Also, please utilize the chat to not only ask questions throughout today's session, but also to provide your name, the organization you represent, and your contact information. We would really love to be able to connect with you guys even after today's webinar. So for our agenda, so today we will begin this session with prayer from Reverend Frederick Streets, pastor of the Dixwell Avenue Congregational United Church in Christ, followed by remarks from New Haven's own Mayor Ellicott. Dr. Ayanna Jordan of NYU Langone will present on today's subject matter. Following that presentation, we will also from our community partners and community supports, starting with Crystal Long from MCCA and Pastor Harold Brooks from Beulah Heights Church, also here in New Haven. We will end this portion with comments from our program's peer support specialist, the amazing Kimberly Guy. And we're also going to end today with the opportunity for questions and answers. So as previously suggested, not only please leave your contact information in the chat, but also feel free to post questions during the chat and we will address all of those at the end of today's session. So now to Pastor Streets to begin today's webinar.
Thank you very much. It's a pleasure and honor to be with all of you. I'm, in addition to being the pastor of Dixwell Church, I'm also a clinical social worker and happy to be a part of the church-based treatment program that we'll talk about further today. So in the spirit of either prayer or meditation or both, please receive these words. Creator God, you are called by many names and worshiped in different ways. Yet from your love, you have created us as one human race. You have placed in us self-healing capacities that can be facilitated by those who bring to bear upon our suffering their gifts of healing. We thank you, therefore, for physicians, therapists, and all those who rally us on in our attempt to live a healthy and meaningful life. We are grateful for Dr. Ayanna Jordan, her staff, and the work they do to assist others in need of healing. We are thankful for the men and women who find the courage to seek help and be in partnership with those who affirm their humanity and hope for a better future. And the people of the Creator said, Amen.
Amen.
Okay, so now I'm just going to share our screen. Unfortunately, Mayor Ellicott was not able to join in person, but he has shared a message with us. So I will share that now.
He just had a governor's meeting. He wanted to come in person, but then the governor had a meeting at the same time. So he recorded the video literally about 15 minutes prior. So thank you for that.
Hi, everyone. I'm New Haven Mayor Justin Ellicott here, and I'm so sorry that I was unable to join you in person today. I was really looking forward to it. I remember a little more than a year ago gathering with Dr. Jordan, Reverend Streets, and others to talk about this initiative, the disproportionate rates of Black individuals who use substances are impacted by COVID, and the importance of providing services where people are most comfortable. Though now a different name, I'm glad to hear that the work continues. Substance use disorder grips far too many members of our community. And like many things, COVID-19 accelerated the need for treatment, while at the same time made treatment more challenging to obtain. I'm thankful for you and your work of providing treatment to our community, especially the services you provide for historically under-resourced communities. Recognizing some of these challenges faced by members of our community, especially in the light of the pandemic, the City of New Haven created a new department, the Department of Community Resilience. This new department will coordinate our work across interconnected areas like homelessness, substance use disorder, mental health, reentry, and violence prevention. We will bring additional resources and data to address these challenges and look forward to working closely with groups on the ground already doing this important work. Again, I'm so thankful to be able to share a few words with you, and even more thankful for the work you're doing to help members of our community get the treatment they need.
Okay, and now we will have the presentation by Dr. Jordan.
Thanks, and sorry that was a little bit choppy, the video, but I think we were able to obtain the sentiment of what Mayor Elliker had to say. So we're grateful for the programming and the support of the addiction treatment in the Black community. So I am going to share my screen and we'll talk for the next, well, I'll talk for the next 20 minutes about what we're actually doing and what is the problems that we're facing. So just give me a sec. And we'll be able to do that. Okay. And I encourage you all to, can everybody see that? Yes, thumbs up, hit not, okay, thank you. Listen, y'all, it's Friday at 1 o'clock. I need some energy from you all here. We are gathered together to really deal with a very important issue in our community. And so I would appreciate your energy, and I just am so grateful for you being here. So I'm Ayanna Jordan. I am an addiction psychiatrist. I'm a physician that specializes in taking care of people with addiction, like substance use disorders, and also conduct research. And so I'm very happy to think collectively about how we can better take care of Black people who use alcohol and other drugs. Just so people understand, alcohol is a drug. So we don't say alcohol or drugs, we say alcohol and other drugs because we know that alcohol is indeed a substance that can be abused. So starting with the why, and I shout out to my sister, Dr. Sherelle Bellamy, who I love dearly. This was adapted by Imani Harrington, and it's a good way to center ourselves. Why do we do what we do? We need you, our brothers, our sisters, our people. Help us reaffirm ourselves in loving ourselves. Hold us when we can't stand, because soles of shoes have traveled on our backs for so long. We need you, our brothers, our sisters, our people. Everyone in attendance today, whether you're Black, white, or otherwise, because we know that race is a social classification that's made up anyway, we need you. We need you all to figure out how to take care of a population that has been historically excluded and not been taken care of. How can we help one another to live better lives? And that's what we're doing when the addiction and addiction treatment in Black community study. I'm going to go through what are the rates of misuse when we're talking about alcohol and other drugs in the Black community. What is the major issue? Why did we decide to partner with the Black church? How is addiction treatment in the Black community studied? How is it innovative? What makes it different? How is it creative? And the importance of partnering with you. Everyone in attendance, how can we work together so that 10 years from now, we're not talking about the same rates? We have the answers, and I'm feeling very encouraged that we can do this together, right? So this is not, I don't think, news to anybody, but the bottom line is that Black people are dying at higher rates due to alcohol and drug use, right? There's increased disease amongst Black people because of their alcohol and other types of drug use, impairment in functioning. That means that Black people are more likely to have negative consequences because of things like infectious disease, hepatitis B, hepatitis C, HIV, because of their drug use. And there is higher rates of death for Black people with alcohol use disorder. That's what AUD means, despite equal or lower use. So the media would have you think that Black people are using alcohol more than white people, and that's not the case. At certain age ranges, Black people actually use alcohol less than white people. But why are we dying at higher rates? Also, Black people with SUD or substance use disorders, that's taking everything into account, have seen an increase by 140% in death due to fentanyl, which is a manufactured type of opioid, okay? Black people are dying because of this fentanyl. This just came out in 2022 that Black people now outpace white people in opioid-involved overdose deaths. And the paper that I'm talking about cites that Black men 55 and over account for the increase in rates of all deaths related to opioids since 2013. So now, not only are Black people outpacing white people in opioid-involved overdose deaths, but Black men over the age of 55 have accounted for that disproportionate rate of opioid overdose deaths since 2013. Why isn't this being covered in the main media in the same way that when prescription opioids were killing white people, we couldn't turn on the TV or see a news story without it being covered? Why isn't this news out there? Another thing that I want us to understand today is that cocaine kills more Black people than opioids. So one of the things that we know in the addiction treatment in the Black community study is we focus on alcohol, but also other substances like cocaine, because we know that cocaine is the #2 killer of illicit drugs. It kills more Americans than opioids. And because of racist policies like the Anti-Drug Abuse Act that was enacted during the Reagan era in 1986, that there were harsher penalties for powder cocaine as opposed, for crack cocaine in comparison to powder cocaine. So what does that mean? Cocaine is cocaine is cocaine. However, our administration in the 80s enacted a law that allowed for more time to be given for crack cocaine, because that is the type of cocaine that more Black people use as opposed to powder cocaine. This led to a sentencing disparity. So you needed to have 100 times more powder cocaine to get the same sentence as someone just carrying 1 time the amount of crack cocaine. Are you guys hearing me? This is the law, right? And even when the Fair Sentencing Act was enacted later in the 2000s to correct for this sentencing disparity, it still remains to this day that an overwhelming representation of the people involved in the carceral system are Black. I'm going to take it to Connecticut so you all understand that drug overdose mortality rates in Connecticut are astronomically high for Black people when you're comparing the rates to non-Hispanic white or Hispanic populations. You can see this is data from 2019 and 2020. This is the rates per 100,000 in terms of deaths. The bottom line is I just want you to see that Black people have had a disproportionate increase in overdose mortality rates in Connecticut. You can see that and compare it to white and Hispanic individuals. And if we look at how the death rates have continued to increase during COVID, it's just more bad news. So this is showing for COVID-19, Black people are in blue, white people are in orange. So if we're looking at the death rates among COVID-19 patients with substance use disorders, Black people are disproportionately affected. This is looking at Black people with all substance use disorders. And then this one is just, again, a recent substance use disorder. So that means that you were diagnosed with having a drug problem in the last year. But you can see Black compared to white, that significantly higher death rates. So why is this the case? If you guys take nothing away from this, I want you to understand it's racism, not race, that accounts for these differences, right? Different ways that Black people are treated in this country and by the general system, addiction system, the way in which we're oppressed really accounts for these differences. Racism, not race. There's nothing inherently wrong amongst Black people that lead to these problems. Black adults are less likely to access substance use disorder treatment in traditional settings. So this is one of the reasons that really spurred the project that we're doing, is to see if Black adults, for a host of reasons, don't feel safe in accessing substance use disorder treatment in traditional settings, is there a way that we can study alternate ways of providing help? So that's where the Black church can be helpful, right? Black people, compared with other racial groups, are less likely to start alcohol and other drug treatment. If they do start, let's say they're mandated because they are court involved and they have to go, they are less likely to stay in treatment. So they have high attrition rates, or more likely to leave. All right. I didn't come here to just leave you with bad news. Do not be dismayed or lose hope. This is one of my favorite scriptures from Isaiah 41:10. I'm not here to proselytize or change anybody to any type of religion. I'm just here to say that Black people are a spiritual people, a divine people who believe in the Lord. And so, fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you. I will help you. I will uphold you with my righteous right hand. We have ways to take care of ourselves, and that's what the addiction treatment in the Black community study is all about. I'm just showing you here, this is George Lau. He was an emancipated slave. He was thought to be the first Black pastor. This is the first Black Baptist church in Savannah, Georgia. So I'm just showing this for history. Why are we partnering with the Black church? And we're so happy to have Reverend Streets as a partner in this. Black churches are effective in helping people live healthier lives. Religion and spirituality enable Black people to cope with psychological distress. We see that. How are we still surviving in the context of anti-Black racism, the Rona? Mitch McConnell just came out publicly and said, African Americans and Americans, they think we're different. Our spirituality has allowed us to withstand some of the most gravest oppression there is. In urban Black communities, 65 to 80% of adults attend church regularly. So another thing is, we know that Black people are in church and people use drugs. That's fine. And so how are we able to partner both of these things together so that we're able to help? And there are many studies that show the importance of church when people often seek help from clergy before they'll go to someone like me or Dr. Kim Sue, who's here, an addiction specialist. This is just a throwback to the work that we did that led us to the study that we have now. This is Mayor Elliker, this is Reverend Streets, Kim and Richard, who are peer support specialists living in recovery. We had a lot of support from New Haven because we were able to show in this feasibility study, which is a fancy way of saying, we showed that people would indeed come to the church to get help, and they actually stayed. So this is from a press release in 2020, showing that when we provided substance use treatment in the church, people came and people actually stayed in treatment. So what is the study that we're doing? It is under the umbrella of what's called community-based participatory research, or CBPR. It's very different than the traditional studies that are done. It's a partnership approach to research that equitably involves community members, key stakeholders. In this case, we're talking about Black people with substance use disorders, researchers, and others like political leaders, faith leaders, and all aspects of the research process. So we are very thoughtful in understanding, what does the community need? What are they saying? How are they participating in the work? How do we change the design to be able to meet the needs of people who are affected? And this is just showing you some data. I just wanted to include one slide about data from that study that we did to show that people were coming to the church to get treatment. I want you all to see the demographics. Only 8% of the population were employed. So most people were unemployed, but they were very much committed in taking care of themselves. 64% had never been married or were living alone. So these were people who were socially isolated, right? And half of the sample, so about 54%, met criteria for severe substance use disorder. So these are people who, because of their alcohol and other drug use, it had really caused dysfunction or impairment in their lives, but yet they still came week after week after week. So I also want to break down the myth that Black people with severe substance use disorders don't care about themselves or don't care about their lives or don't care about their health. That's not true. If we have an opportunity to take care of ourselves, we do better. This is just showing you that 39 of the 40 people in that study completed the study, and we asked them if they were satisfied with the care they received at the church, 0 being very dissatisfied, 5 being very satisfied. They rated it as a 4.5, so overall very satisfied with their care. I also want to be very transparent and understanding that this work has not been easy. This is why I need your support. There have been so many barriers. The National Institutes of Health, which is the government agency we pay our taxes to, one of the major funders of research in this country, they didn't believe in the idea. They said, we don't want to fund research in the church. Nobody's going to go. That's ridiculous, Ayana. Some people called the project racist. Less than 1% of researchers in this country that are funded by the NIH are Black. Part of why I'm doing the seminar today is because I need your help in showing NIH and other regulatory agencies that we can do this work and we can take care of our folks. Also, during the pandemic, there were folks at Yale, they didn't want to approve the site of research. So many barriers. But one of the things that I found strength in is, one, knowing that the community was with me, like many of you all who showed up on a Friday, but also I love this quote by the Reverend Dr. Martin Luther King Jr., Reverend Doctor, right? If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. People today, we have to keep moving forward. Our folks are dying at disproportionate rates. We can and we must do something about it. And so I'm really excited about the project. So what are we doing in ATBC, the Addiction Treatment in the Black Community Study? What exactly happens if I'm interested in the study? First, we have a recruitment event. So we say anybody that meets criteria for alcohol and other substance use disorders, you have to have a diagnosis of an alcohol use disorder, but you can also have other substance use disorders like cocaine, like PCP, like methamphetamine, like heroin. We have a recruitment event. Then at the recruitment event, people are randomized, which means that there is a selection that happens that we don't have anything to do with, is totally blinded, that assigns someone to either treatment in the church at Dixwell Avenue Church or at our partner site, MCCA Addiction Treatment. And we're so happy to have Crystal here to talk about that. If you get assigned to MCCA, you do enter treatment in a timely manner. We have worked with them to make sure that people get assigned to treatment in 1 week or less. And then they decide based on the evaluation if someone goes to outpatient therapy or intensive outpatient therapy, or if they need to do detoxification first, then go to therapy. But that is the direction of MCCA. Then at Dixwell, if you get assigned to Dixwell, there are modules that you go through, CBT for CBT, computer-based training for cognitive behavioral therapy. This has been shown in a host of studies, both in combination and alone, to decrease substance use. My mentor, who is now deceased, shout out to Kathy Carroll, I know she's here with us, developed this. Everyone has week 4 follow-ups with research assistants. Excuse me, sorry. And then everyone has post-assessments at the end of 8 weeks, and then we follow you at 3 months, 6 months, and 9 months, okay? So that's what actually happens towards the study. And the whole point is to see which one of these works better. Which one of these is more acceptable to Black people with alcohol and other drugs, okay? ATBC, addiction treatment in the Black community, is innovative. It's unique from other research projects because I told you we have a strong focus on community-based participatory research, community trust. We're not just going to pop in and pop out. We've been doing this for years and really deciding after we do this, what's the best way moving forward to make sure that people can get the treatment they need and stay in treatment. Delivery of services by and for community members. So we have church-based health advisors, we have research assistants who are all reflective of the community that we're serving, Black people. There's flexibility of the randomized controlled trial. That's just the type of trial that we're conducting, that we integrate feedback from the peer specialists and from what people are saying to make sure that we're meeting the needs of our participants. Okay, these are just flyers so you understand. We are narrowly and myopically focused on Black people. This is a study just for Black people who are interested in cutting back on their drinking and other drug use. You do not have to want to abstain from alcohol and other drugs. You just need to want help, right? So if you know anyone that's interested, please have them call 203-641-1218 so that we can get them in the study. 203-641-1218. And compensation is up to $530 if people complete all 8 weeks. The last slide is we need you. Promoting this project, I need you to let everyone know. It says, if you want to go fast, go alone. If you want to go far, go together. That's one of my favorite African proverbs. I don't necessarily care about going fast. I want to go far. I want to help our folks who are suffering unnecessarily. We value your partnership. If there are places in New Haven, there's 2 asks. One, we need a neutral recruitment place. So we don't want to recruit in the church, and we don't want to recruit in the addiction treatment center. So if there's like a community center in New Haven or a library or something that you know would be a good place to have recruitment, please let Tracy know. Her number's there. And then if you know anybody that's interested in participating in the study, then you can let LaWanda know, and her number is there. I want to just acknowledge the churches and the pastors who've been working alongside with us, and you'll hear from them. You've already heard from Reverend Streets, all the facilitators that have helped, people with lived experience, and most importantly, in the memory of all who have died unnecessarily to the drug overdose crisis. There's so many people that I have to thank. Just no way I can do this alone. These are all members of the team, and it's worth putting their names up here because they're excellent. More acknowledgements. And then finally, I always say, I love being Auntie Ayana. I love being a fur mama. And so this is my latest fur baby in Wangari who died last year. This is in memory of my research mentor, Kathy, who, sorry, I get emotional, who really taught me what it is to be a compassionate leader, what it is to be an authentic leader, and how to lead with love and authenticity. All right, I'm going to stop sharing. I want to share a video that my sister is singing and my niece is dancing, because it really underscores the effort and the passion behind this project. Black people, we are at a point where we need to take care of one another, and we need help for those to partner with us. So this is one of my favorite songs, and I can't sing, so I'm having my sister do the singing and my niece to share. All right, she did a dance, and I'm going to share this.
Why should I feel discouraged? And why should the shadows come? Why should my heart be lonely and long for help and home when Jesus is my portion, a constant friend is He. His eye is on the sparrow, and I know He watches me. I sing because I'm happy. I sing because I am free. His eye is on the sparrow, and I know He watches me.
All right, thank you all. We want to make sure that we have time for questions, so we'll move directly into MCCA. Crystal, please.
Hi there, my name is Crystal Long. I am the program director here at MCCA here in New Haven. I want to highlight the importance of addiction treatment. It is very, very important. Right now, we are seeing an increase in fentanyl use, and because of that increase, there has been an increase in overdoses, which is leading to death. I will say that addiction treatment is going to create awareness for all of our clients. It's going to help educate our clients with regards to what they're taking. A lot of times, clients are using cocaine, they're using PCP, they're using all kinds of substances, and they're really unaware that half the time it's being laced with fentanyl. So really, treatment is it's so necessary. In treatment, we do offer medicated assisted treatment, which is Suboxone and methadone. When you're going to any sort of treatment facility, make sure that you're encouraging clients to ask about those. That'll definitely help with the fight against addiction, especially addiction to opioids. I can't highlight enough the importance of treatment with regards to group therapy. Clients are going to be able to process their triggers, process their emotions, process traumas, griefs, all things that are associated to using. So if you can really encourage clients to get involved in the study, so that way they're able to either, go the church route, or if treatment is needed, we're able to help in any way that we can. Okay.
Awesome. Thank you so much, Crystal, for being a partner and believing in the study. So we appreciate you for sure. Yeah. All right.
Next, Pastor Brooks. There he is from Beulah Heights. Thank you.
Good afternoon, everyone. I just wanted to give, first of all, a personal testimony. I've had a family member back in '76 who passed away because of alcoholism. And family members who are struggling with other addictions. And so here at Beulah Heights, we've had a long-standing running in the community of helping and supporting various programs with Yale and other community groups. And so we're here to support this program in any way possible. And so we believe in it, and we'll do whatever we can to support it. And thank you for the opportunity, even just to serve the greater New Haven, Dixville community.
Thank you, Pastor Brooks. It's been amazing to work with Beulah Heights. You guys have been just brilliant in supporting us in every step. And so we say Ashe, thank you for all your support and also allowing us to work with Brother Joe closely. Thank you.
Okay, and now we're going to have remarks from our peer support specialist, Ms. Kimberly Guy. Let me just share my screen.
Kim is a peer engagement specialist in the project, and so we'll hear from her and then we'll open it up for questions.
For recovery and community health under the umbrella.
Start it from the beginning.
And can we make it large, Tracy? Just expand it so it can be full screen. Not picture in picture, just.
Give me 1 second, please. There we go.
Perfect.
Hello, let me introduce myself. My name is Kimberly Guy. I work for the Program for Recovery and Community Health under the umbrella of Yale University. My role at the Black Church is a peer supporter and an engagement specialist. A peer supporter is a person with lived experience and that they try to gain connection through mutuality and respect and meeting the person exactly where they're at so that you can better support them through their recovery journey. And as far as engaging the community to educate them on what we're doing as far as in the Black church and see if there's something that might stimulate them that they might want to join in our program. The program is greatly needed. I have 18 years clean off of crack cocaine, and it still is in my backyard. I lost my daughter in 2018 from a fentanyl overdose, and she was 27 years old, and it wasn't much programs that she can get in. The waiting list, the call every day, and people, when they're ready to get clean, they're ready to get clean. So I believe that this program will greatly impact our community. And if you in your community know someone or have someone that might need some support, just send them over to us and stuff, because this is getting to be an epidemic and we're trying to save lives. And if anybody could support us, please do so.
All right, so we are done with the formal presentation, but we do want to open it up, and we're happy to take questions and hear from you all. It can be questions about kind of the state of what's happening with Black youth, substance use, or the project in and of itself, but please do, let's open it up. We can, yeah, let's just open it up. You can take yourself off mute and ask a question. Maybe just say who you are.
So my name is Doreen Abubakar, and I am the founder of Community Placemaking Engagement Network. We predominantly serve the New Hopeville area. I didn't know about this community research project, so I'm excited that I got the invite to be on this Zoom today. But I just wanted to share that for the past 3 years, we have been doing education centered around the 16 to 21-year-old, basically giving them certain trainings to become prevention advocates for drug and alcohol abuse. So we would love to. We also do smart recovery meetings, which is the evidence-based training. We do meetings once a month and we offer them to other people. And we would love to have churches to do or host a smart recovery meeting. It's a once a week, 1 hour behavioral cognitive program for making changes for the individual to learn how to monitor themselves. You know, so they get tools and have support from other people in the same predicament. The program tailors to any addiction, whether it be gambling, smoking, using drugs, and so on.
Thanks, Doreen, for being here and for letting us know what your program is about. We'll make sure that we get in contact with you.
Yes, please.
About how we might be able to partner.
Thank you so much.
I'm going to send you the program manager's information now. Others, questions, comments, reactions, please.
Hello.
Hi.
Thank you, Doc, for that. That was very, very interesting. My name is Shawnette, and I'm the new community outreach worker for the city of New Haven.
Oh.
And yes, and we can talk, Doc, because there are so many avenues that are under my umbrella that can be whether recruitment or for place to do the services. I'm very much interested.
Thank you. And it's wonderful to have you in that position.
Yes.
So we'll definitely be able to connect, and I'll send Tracy's information to you right now as well. Thanks. I see there's a hand up. Shamaroon, please. I love your Black Lives Matter. That's very awesome. Your head wrap. Yes, go ahead.
Thank you. My name is Danielle Warren Diaz, and I'm the program director of a family pediatric youth and family HIV program out of Connecticut Children's Medical Center. So I hail from Hartford. But it's wonderful to hear about the work that you all are doing in New Haven. And for the speaker right before the last person that spoke, we were just funded to do smart recovery for youth as well. And when we wrote for the mini grant, we reached out to a Black church in the north end of Hartford. I was born and raised in the north end of Hartford. I don't know if you all know Hartford, but that's the predominantly Black community in Hartford. So we did reach out to partner with a church in order to give smart recovery groups in my neighborhood and in the Black community in Hartford. So it's something because, I always tell our team that, we follow the universe. We follow what God leads us to do. And so many times things are right on point, because right after we got the overdose of the 3 kids in the school system. Oh, yeah. So it was something that we had just got awarded.
Uh-oh, I think we lost you, but we appreciate that you being here. But I think one of the things that I'm seeing is that there are so many people in our community that are working towards helping our folks with addiction. And we just want to really debunk the narrative that we don't care about ourselves, or that we're not doing what we need to do to take care of ourselves. A lot of people, when you know better, you do better. And when there's easily accessible resources and treatment options, you engage. But so much of it is just so hard to get involved. Like you heard what Kim was saying about her daughter, like who and when they're in the active throes of addiction can keep calling and calling and calling. You can't. It's very erratic. That's addiction in of itself. There's impairment. And so one of the things that we're saying with the addiction treatment in the Black community is, can we provide a way to make it easier for people to get into care and then see which one works better? So from that data, we can then say, okay, let's do it this way or that way. We don't know, right? We don't know. And so that's what we're trying to test. So I love you all being here and sharing with all the different groups that are going on and really debunking that narrative.
Hi.
Yeah, hi. Thank you, Dr. Jones. Yeah.
Hi, I'm Dr. Sharon Jones McCann, and I'm presently the program manager at Keith Community Center. And thank you so much for the invitation to be a part of this. I work diligently with the community and Hampden at large. And people tend to forget that Hampden has Black folks who also are homeless and have substance abuse problems. I worked 14 years for advanced behavioral health as the women's recovery specialist. And what I tend to see in the New Haven, Hampden area is there's no place for those women who come back, who want to become clean and sober, to have a place to live. My desire to have more women in children's shelters. There are actually only 7 women in children's shelters in the state of Connecticut. It is so horrible, and I know firsthand from working with them. They want to be clean and sober, but they have no place to live with their children. People tend to forget that these women come with not baggage because they're children, but they come with little people and they need places to go. And I, like the young lady who says she lost her daughter, I know from working at ABH, they put you on a wait list. Now the ABH doesn't even have it. You have to call 211 to get on that call to be able to find places. We need to work harder. And I love the fact that you said, if you want to go fast, go alone. But if you want to go far, be as a group. And we need to go a whole heck of a lot farther by trying to get places for these moms who come back, who get themselves straight, who go to FERP, who go to App Foundation, get themselves straight, and then have no place to live because they've messed up their credit for whatever reason. And that's one thing I love the fact of this group. I didn't know about it, and I've been doing this work for quite some time. I didn't even know of this group, but I'm so glad that now that I have been acknowledged.
No, thanks so much, Dr. Jones, and pointing out the intersecting identities of addiction, right? It doesn't just affect the person, it affects the entire family. When you're dealing with a parenting person, a woman who has addiction and is trying to initiate recovery, you have to think about the little folks that they are in charge of. You have to think about supports for that. And how can we first engage in treatment, right? Keep people in treatment, but then also partner with case managers and social workers that are going to work with our folks to find these resources. Another reason why it's important to have this recorded and then to really be involved with the mayor is to show this and say, like, 211 ain't going to cut it, right? I always say all research is political, science is political. You can say it's neutral, it's not. And one of the things that we have to do is show up and say, okay, so we're doing our part. What are you doing as an elected official? So this is an important discussion, and yeah, it goes beyond the research project, but how can we advocate for more?
And I believe, I believe that not only bring it to the mayor of New Haven, but the southern end of Hampden is actually New Haven. Why can't we bring it to the new mayor of Hampden, Mayor Lauren Garrett? We need to let them know. The more involved, the more people involved, the better support we can have. It is dangerous. People just keep tending. I'm a New Haven resident, so I know, but I work in Hampden. And people just tend to think Hampden has no problems, no anything. But now there's a new elected there. There's a new regime there. Let them know, see what they can help with on the southern end of Hampden.
Yeah. Others, thank you for that. Others, comments? We have about 5 minutes. I see a hand, please. Shanera? Yeah.
Hi, everybody. Shanera Billups, LPC in New Haven. I work with Breakthrough Counseling Services under the Circle, but I also have a LLC, Mental Growth Internal Healing LLC. So I do reside in the Hampden area, and I absolutely do agree. I feel that it should be brought to both mayors' attention because it seems that the when it comes to Hampden, the end that gets more attention is perhaps one of the shall I say, more of the suburban type of high end. And it's like, okay, Hampton doesn't have issues. New Haven, New Haven, New Haven. I grew up in New Haven and I've resided in Hampton. I've gone to school in both places and trust and believe it needs to be addressed, cross-addressed. I would like to know, though, how we can become much more supportive of this program in place, because even with, with the women and children, women who become clean, or I'll just say even single parents, because you have some fathers who take care of their children primarily, and it becomes super challenging for them to receive support, because it's like, you're men, okay, that's great. You're men with children, you still need assistance, but how can they receive support so that there's no there's a lessened amount of relapse that's happening? And even for women, it becomes challenging, because it's like, okay, if they become clean and they're trying to keep their children, they're willing to do anything for their kids. If they find that they cannot get assistance, well, it's either back on the streets or give up their children to the system. And they rather not do that. So God forbid, even if they come out of domestic violence relationships, that's a big one too. They'll go right back to their partner if they had some kind of shelter. And a lot of situations go underreported unless you're asking questions. So I would love it if we could know how can we bring more awareness to this and provide more assistance in that factor, if I can get some information too.
Yeah, Shanera, I just sent you Tracy, the program manager's email address, so just make sure you get in touch with her. We only have a few minutes, so I'm going to say Robin and then Kathy. That'll be the last comments. I just want to say this is just the beginning. We'll have a couple more of these discussions, but I think we're seeing that there's a lot of support for this and that it's very complicated, right? This is one step, but there are so many issues that need to be addressed. So please, Reverend Robin, and then Kathy, you'll have the last word.
Thank you. Thank you, Dr. Jordan. What a awesome presentation, but also, again, continuing to let us know that it's so much work that needs to be done, and really how do we support the work that is being done. And so I just wanted to say today that any way that you have my any way that I can support the project, and certainly we have also crisis counselors and case managers that can actually refer people to the project. So if we can get that information, and then also maybe some of us can post it on our websites, as well as, possibly even in our churches, being able to raise it, because I think it's such important work that not only will assist people right now, but also in the future for the work that is still needed, even beyond the next couple of years, or that right today. Thank you.
Thank you so much, Reverend Robin. I just appreciate you. There is no way that I could have come this far without you. So thank you. And I'm going to post LaWanda's information to get involved. Kathy, you have the last word, please.
It reminded me when the woman that, and I forgot her name already, so my apologies, that said, we need places for women and their children to go. We also need treatment options for women and children. When I worked at Family Children's Agency in Norwalk, we were a dual diagnosis program for women only, and we provided those women transportation and childcare so that they could do an IOP. Because a lot of the women, said that if they didn't have someone to watch their kids, they couldn't get treatment.
Mm-hmm. Yep.
And we also had a van driver who went around and picked up women in the community. Could some of them take on the bus? Yeah, but some of them were carrying, 2 child carriers and all their, all the stuff with them, and that would have discouraged them probably from coming. But having somebody pick them up and bring them to treatment, and then having somebody to watch the children, really encourage women to seek treatment they wouldn't have before too.
Thank you, Kathy, for that. And just again, underscoring all the social determinants that have to be addressed. It's not just getting treatment, it's all the totality of it. With God's love, I say thank you. You all showed up today and showed out. And for that, I am truly thankful. I wish you peace during this really tortuous time. And I say, please find a way to create joy and find joy in your life. Ashe, everybody. So it is, and so it will be.